The vast majority of cervical spine surgeries involve removing part or all of a disc or discs within the cervical spine. The human cervical spine is made up of 7 vertebrae, and starting from top on down, and the last bone within the cervical spine continues on from there into your thoracic spine. Most cervical spine surgeries done involve removing part or all of one or more of the discs, the cartilage discs that sit between the vertebra. And the vertebra or bones are these big gray squares, and in between each 2 vertebrae sit a cartilage disc. The cushion between the bones is how I like to describe for patients. And most cervical spine surgeries, like I mentioned, consist of removing part or all of a disc or discs that have either deteriorated badly or part of the disc has ruptured, such as you see here. And the disc rupturing or herniating into this space is where your spinal cord travels. This long black stripe is your spinal cord, and when one of these discs ruptures, it either causes pressure on spinal cord, as you see here, or it can cause pressure on one of the nerves that branch off the spinal cord. And pressure on a specific nerve or spinal cord is what generally causes the majority of the problems for any given individual. Either a radiating pain down their arm associated with either weakness or numbness, or in worst case scenario, if a person's spinal cord is being significantly compressed, it can cause a patient to be either paralyzed or have problems or deficits, including balance difficulty or even bowel or bladder abnormalities. And what surgery then involves is removing that injured disc, or the disc causing the nerve pressure. And once that disc is removed, it first and foremost relieves the pressure on spinal cord or nerve. And then in that space where the disc was removed from, we fill that space in with a special device filled with bone, and then we place usually another small device, typically a thin metal plate, along the front of these 2 bones, and that cage, as it's called, that is inserted between the bones, fuses those bones together over typically a 3 to 6 month period of time. In other situations, instead of placing a cage and bone between the vertebra and fusing the vertebra, we can place an artificial disc between the bones, and in placing an artificial disc, we retain movement between those bones rather than the 2 bones being permanently fused together. The beauty of many of these cervical spine surgeries is they are minimally invasive. The recovery afterwards is often quick. The amount of discomfort that a patient experiences after many of these cervical spine surgeries is far less than discomfort that is often associated with a lower back surgery or a mid-back surgery. And another great thing to many of these cervical spine surgeries is the success rate is often very, very high.